Good afternoon. Today is Thursday, December the 3rd, and this is our weekly COVID-19 update briefing. As of today, Bossier Parish has 6,528 positive cases. That's an increase of 494, the largest increase we've had since we've been tracking it. So we're continuing to have our share of the problems here in Bossier Parish. Unfortunately, the deaths are now at 158 for the parish. That's an increase of 11 since our last briefing. Governor Edwards announced yesterday that Louisiana has entered a new and dangerous third surge of the COVID-19. Positive cases, increased hospitalizations, numbers of deaths, and the impact that this has had on hospital capacity and medical staffing resulted in his issuing proclamation number 168, in which the state regressed to a modified phase 2 of the recovery effort, and this runs from November the 25th until the 23rd of December. The governor cautions that we should not expect to reduce restrictions just prior to Christmas. It's likely that his orders will be extended, perhaps with some modifications, through Christmas and New Year's. He is hopeful that we will not have to put more restrictions in place for the holiday season, but has not ruled it out. And if it appears that our hospital system is going to be overwhelmed in their capacity to deliver health care, he will make the tough decision as required. Hospitals are cautioning that the latest trajectory of cases is, if it continues unabated, will overwhelm their facilities. So the governor indicated he will have no choice but to put more restrictions in place, that we simply must not overwhelm the hospital capacity to deliver health care. The Louisiana Office of Alcohol and Tobacco Control and the Louisiana State Fire Marshal Office recently reaffirmed state businesses community that both agencies will continue conducting compliance enforcement of blatant violations of Governor Edwards' proclamation. However, the governor has conceded that strict enforcement statewide is not feasible. He has stated that if people insist we enforce our way through this, we're doomed to failure. He urges that we be good neighbors and voluntarily and consistently comply with prevention and mitigation procedures. Positive test results within the state has been as high as 12.8% recently, but it is down now to around 8.2, correction. Our goal is to be at 5% or lower, but the surge of positive cases across our nation and internationally remains a major concern. Pfizer has announced their vaccine is 95% effective and will be available before the end of the year. Moderna just announced that their vaccine is 95.4% effective, and it does not require special transportation in extremely low temperature containers. Both may be available by the end of the year. A third vaccine, AstraZeneca, is also in the pipeline. The Food and Drug Administration Advisory Committee is set to meet this coming December the 10th, when it could approve Pfizer's vaccine quickly. If so, they think they can make that decision within about 1 day, and Moderna should be close behind them. Determining priorities for receipt of the vaccine and the logistics of distributing them is being determined by the powers that be. It's likely that the first to be vaccinated should be first responders, healthcare and nursing home workers, the elderly in nursing homes or at home, and those with chronic medical conditions. The governor expects the state to receive about 80,000 vaccines during the first 2 weeks of distribution, but for the general population, it's anticipated we may not receive those until about May or June of next year. As local doctor Philip Roseman has noted, quote, "The faster we vaccinate high-risk individuals, the quicker we will see lower death and hospitalization rates. It is my understanding that the vaccine is now being pre-positioned in areas to be the first to receive them, and they expect approval to authorize those vaccinations soon. Their concern is that when vaccines are available to the general public, there will be some reluctance to receiving the vaccination. The effectiveness of the vaccine could be minimized if large numbers of people refuse the vaccination. The numbers of individuals who are asymptomatic is estimated to be as high as 50%. But as we all know, I believe that these individuals can still have and spread the illness and cause death to others. Wearing masks remains a major issue of concern, but it has been directed that every individual in Louisiana at the age of 8 or older shall wear a face covering both the nose and mouth when in a commercial establishment or any other building or space that is open to the public, whether indoors or outdoor, and this includes commercial and public modes of transportation. The CDC recently announced that young children are more likely to contract and transmit the coronavirus than previously believed. They now recommend that children as young as 2 years or older wear a mask. The governor has stated that, quote, all the information we get from the White House and other experts indicate that we are in for a couple of really tough months. Medical experts predict an increase in positive cases now that the cold weather season has arrived and more people are staying inside. They are concerned with the spread of the virus through small gatherings such as weddings, Christmas and New Year's events, the holiday break from schools and colleges, when people just tend to let their guard down at these times, and that's unfortunate. As we wait for an effective and safe vaccine, which is likely to be before the end of the year, what should we do to save lives and improve the economy? And they remain, ladies and gentlemen, that we should be following the prevention and mitigation protocols, which are, as always, the following. Wear a mask. Wash your hands. Cough into the bend of your elbow. Do not touch your face. Disinfect surfaces. Social distance of at least 6 feet. When you're sick, stay at home and follow the advice of your medical provider. And as always, avoid crowds. Next, what can you do? Get a flu shot. The CDC and governor urge everyone to get the vaccination to help prevent potential of compounding the problem of having flu season and COVID-19 pandemic occurring at the same time. So we urge people to take the COVID-19 vaccination when they become available. A major change was announced yesterday. The CDC now recommends quarantine time after being exposed to COVID-19 be shortened to 7 days with a negative test result and 10 days with a test if they have no symptoms. They still say that ideally 14 days is still desired, but that it's been proven that there's a very low risk in those last few days, so that's what they predicated. They're lowering these down to 7 days and 10 days. It's hoped that this shorter period of quarantine will encourage more people to comply with quarantining as we go into the future. So thank you for your continuing participation in our fight against this deadly pandemic. Our next scheduled briefing will be next Thursday, the 10th of December. This concludes our briefing for today. Thank you and good day.